Hello and welcome to the dental clinic of the Paracelsus Clinic, and I'm here with Dr. Gunnar Reifert, who is a medical dentist. Welcome.
Welcome you too.
Dr. Reifert has been treating me for all my problems in my teeth, we will come back to later in the interview. So when a patient comes here at the Paracelsus Clinic, the first thing they are sent to is the dental clinic, like I was. And here you're going through the panorama x-ray, you take the 3D x-ray, you do all the tests and you check the health of the patient.
Yes.
And out of that you are planning out treatment plan.
Yes.
And like you did with me.
So sometimes we have to wait with dental treatments because of the immune system of the patient, but that will figured out in the medicinal section. They will tell us, okay, that patient, please don't make surgery. We have first to rise up the immune system and prepare him. So, but always is possible to make metal sanation, amalgams out, and white gold and other things. Maybe even the titanium implants, but that is in some cases they will be let it there. In some cases we have to pull them out.
Yes,
it's the individual dependent.
So I will say from my own experience, maybe the best investment I have done so far the last 15 years when I was searching for my health issues was to come to you and to do a real check on my teeth, where you also found on two main problems who nobody else have been finding for 15 years, also other holistic dentists. And for me this has been, I guess, the best investment I've done in these 15 years.
Thanks.
And
by the way, we have our Paracelsus Academy. We are teaching everybody about dentistry too, so that if some dentists are interested to see what we do and to get some more information, so they can go over the web page to the Paracelsus Academy, and we are happy to have here hospitants. Quite often we have somebody here who is looking what we are doing, and of course we introduce them to the medicinal session so that they figure out how maybe the own network has to be later in their own practice of what you need.
So you don't keep this as a secret, you share it by...
No, we are interested in sharing, so because successful treatments makes happy everybody, the dentist, the patient, and you will get more, like a dentist, more patients if you have success, so I think.
Yes, we definitely need more dentists like you. But first, Dr. Reifert, what is biological dentistry?
Okay, to put it in short terms, it is for example, not to put dangerous materials in the body, but suppress immune system, enzymes, functions, or put the right materials inside later. So also it is the elimination of chronical infections, what is not necessarily visible on the normal X-ray what you take in the normal clinic, dental clinic, so that we are digging a little bit deeper to find out which things can disturb the immune system, the meridians, the whole functionality of the body. Because if you have some breaks, even the Porsche will not like get the high velocity. So.
Exactly.
So, and that's is of course more complicated, but so to find out what disturbs and what is toxic and eliminate that, and to make the body again functionally. So that's the point.
Yes. For 1 year ago, it was I didn't know how big impact my mouth and my dental health had on my rest of my health. Can you tell a little bit about why this is so close connected?
Okay, first of all, the mouth is the entry of the digestive tract. So also, if you bring something inside what is affecting the whole system, then don't wonder if the stomach or the colon is working not properly. The second is comes from the Chinese medicine. Every tooth has a connection to some special meridian, so that there are also, if you have some inflammation there or some irritation, the meridian will be suppressed. It works like a negative suppressive acupuncture. So that we can test with fine energetical tests, and even we can test after the treatment if that dysfunction disappear. So as we have representative to every meridian are connected teeth, and if you have problems on some special tooth or the tooth area in the jaw too, then it will be always some affection to some meridian and to the organ, of course, what is coupled to. Yeah.
For normal people, this could maybe be a little bit mystical what you say, but what you're talking about here is also experience. Many years of experience that, for example, certain teeth is inflamed, and this have directly relation to organs or special illnesses. And when you repair this problem, then the background of the illnesses is way. Is this how things are working?
Yes. If you look, for example, at the acupuncture meridians, you will see like a problem here in the leg can be affected from some problem here in the tooth area. Also, there are a lot of connections to the head. So the second is that is like empirical knowledge of the Chinese medicine, that is 5,000 years old. So for me, it's not a question: do we have to approve it scientifically or not? There are studies that say it works, acupuncture. For me, is a question of experience of like doctors that are already using it for 5,000 years. So, and in the practice, I'm using it too, that knowledge, to disconnect, like, for example, to treat some problem in the articulation down there with the treatment of some teeth area. And that works. So we have a lot of cases, patient experiences, what we will publish soon. Of course, without the name of the patient, a lot of them, they want not to stay in the public media, but they can write down the experiences, how chronic diseases disappear if you treat the dental area, make a sanation. So, and there are other things, for example, dead teeth, even filled root canal teeth, they can make emissions, bacterial toxins. There's a study from, there are some studies that can show that every root canal tooth is infected finally, more or less. And the emissions, like TUETR, for example, or inflammatory kinins, interleukins, for example, or rantes, trigger always the immune system to overact. That's the way to the allergies. And if the immune systems finally they go empty, with the time, then it's the way to cancer. So that's why we are already working preventive in that way. Always, if you have some chronic infections in the jaw or some root canal filled teeth, you can approve it scientifically with lab tests, high rantes in the lab test you will find. And that always triggers the immune system and keep it away from the normal function, search and destroy cancer cells, for example.
And this is also what they found to me, also high levels of rantes in my blood test.
So you had not so much to do, let's say. We have other chronic patients that are but have a lot of other problems. Here we have a cone beam X-ray from your case. That is like, it's about here the wisdom teeth, for example. They're like very high in the sinus. So normally, if you look at the sinus gum, is already swollen here. You have also mostly on the left side here a thick sinus gum. What shows up is a chronical inflammation there. On the right side, not so much. You can see maybe the sinus gum is even swollen because it has a connection to the colon, and then if the colon flora is not well, can be the same picture here. So that's a secondary link. How, because the colon meridian is coupled with the lung meridian, and the lung meridian is coupled with the sinuses. So, so that we have maybe here two reasons why the sinus is swollen, sinus gum is swollen here, sinus membrane. So that wisdom teeth, they are connected compared to the Chinese medicine to the small intestine meridian and to the heart meridian. So also the function of that two systems can be suppressed. The heart meridian, okay, sometimes is the heart by himself, like the organ. So some people get ischemia, for example, or heart-ridden problems because of that. But normally it makes a lower stress resistance. So that is here the like a negative acupuncture, it suppress your stress resistance. And if you pull them, it will be go less. The sensitivity is to stress, for example. And also the small intestine meridian will be in a better regulation form. What means regulation? If you compare it to the car, and you can, for example, accelerate it from 0 to 300, yes, km per hour, or use the brakes and stop it. So you have 100% regulation. If you can only accelerate to 100 km per hour, or your brakes don't let you stop immediately, that is limited regulation. The same is in the human body. The vegetative regulation of the small intestine or of the heart is limited if you have problems like that. So also it's more about the software. Yeah? In the car is not about the hardware. But the hardware here affects the software. So
yes, and this is also one of my problems. You know, my small intestines has always been a problem. And I've been treating this for almost 15 years intensively with holistic medicine, and nothing has been helping. So maybe then the tooth was triggered out.
Yes. But it's so that normally we have like 40-50% of the reasons for diseases can be here, and the 50% has to treat the medical section. So that's the point why we have to cooperate with the medicans very close, because we affect the work of each other, or let's say make it better.
And this is one of the unique parts of the Paracelsus Clinic, because here you work very tight with the doctors, medical doctors, and the dentists are working tight together about all the patients.
Yes. So I'm happy that I have support from the medicinal section, because every case can go wrong. For example, here was the ability to break the sinus membrane here, what was not happened, but or get a secondary infection. And the normal answer will be from the school medicine to treat it with antibiotics. So, but they don't realize that if they make a high concentration that will work in the sinus of antibiotics in the blood, they will affect the colon flora and the skin flora everywhere else. You can imagine the colon flora weight is 2 kilograms, and that guys are working for you if they are symbiotic with you, milk acid bacteria, bacteroides and others, or they are work against you. So if you kill them all, the good guys with antibiotics, you will have already colon infection. So that's why we are careful with antibiotics, and so preventing the case of resistant bacteria. So and using our stuff here to push the immune system high.
Let's see a little bit what you do practical here. Also during the surgery with me, you after pulling the teeth.
Okay, the teeth was pulled out. So normally here that was covered with gum, so that you not can see here, but that teeth was under the gum. Also I made a little cut, flap it by side. Was carefully trying to rotate them out. Then we, it was successful. The sinus membrane was not damaged here, and here too on both sides. So then that area has to be disinfected, but because if you open the gum here, the mouth flora will immediately appear here in that area. So that we use ozone, for example, to disinfect that area, preventive, and to push the immune system to hold it clean, because the immune system can have other priorities, for example, to fight against the colon flora. So we have to put the attention of the immune system in that area. What I did with the artroquilan, what is a homeopathic, or it calls in oil Propionibacterium acnes, is a homeopathical medicament what takes the attention of the immune system here to that area against dental anaerobic flora. And so until here the gum was closing, the attention of the immune system was here to hold it clean. So, and it was right, your operation was like almost, one was like week ago, other couple days. We don't have any infections, and it works properly. So.
And then you use also some other things I have not seen before?
Yes, so we use, for example, to be to make it like the regeneration better in that area, because here has to be bone later organized, and of course the gum has to close fast so that no infection can go in. We use growing factors from the blood plasma. So if you there are a lot of growing factors in the blood plasma, because but they are not active if you have blood cells around. That is made so from the organism, because if you have active growing factors and the blood is going through vessels, the vessels will slowly close, obturate by growing. So that to activate the factors, we have to separate the blood cells, erythrocytes, leukocytes away from the plasma. That will be made in a centrifuge, like 10,000 turns per minute, like 9-10 minutes, and then blood is separated. And then in the second fraction, what has not so much fibrin, we will take out the plasma.
This is the middle part of the plasma?
Yes. And then it will be coagulated with some chelates, and then you will get some jelly. That jelly I was putting here. With that jelly we fill up the cavity that appears after extracting that wisdom teeth, and so was filled up with that PRGF, plasma rich in growing factors it calls. So there are some firma that is selling all that knowledge. I don't say about that now, but who is interested can find out. So, and so we was not we was able to do it without antibiotics. Of course, then with some high vitamin C infusions, additive in the medicinal section, we can support that immune system activated. Was done well, and we don't have any problems here at that point.
Dr. Rau told me that with these methods, what you use there, in more than 99% of your patients, you don't have problems afterwards.
Yes.
That is pretty unique, eh?
Yes. we are happy to get that method. Normally it was used from the dermatology for some victims after burning the skin, so for skin regeneration what it was used. And now it is used in the orthopedy for some arthritis, arthrosis. Even the ladies here in the house who has too much wrinkles, they like to get shots to regenerate the skin. So it's a universal useful tool for us. So, no. Okay, so in your case, I think it's that is the only dental problem what you had here. So the rest was well, and that is one of the cases where I had not to do so much. So
Yes, that's good.
no chronic inflammations in the jaw, no root canals, no amalgam fillings to take out. So like an easy job. So for us, normally we have worst cases. You can sometimes like with intolerance of titanium. If you have a patient with 20 implants, that is not so easy to handle. Then they have to be pulled all. You know.
Is it so that in this clinic, everything who is artificial except pure ceramic is a problem?
Not necessary. We will check, for example, we have a lot of cases with titanium implants which are not yet causing intolerance, but every additive metal in the mouth can cause that intolerance. You can imagine if and Galvani in the 18th century already find out. He, for example, made some experience with frogs. He makes sections of the frogs, and then one time his pincet break. He has like an iron pincet, and then was repaired with a copper arm. So he had like one iron, one copper arm. So with that pincet, he was touching muscles in neural tissue of frogs, and they was reacting, cramping. You know, so he find out that micropotentials can affect the body. So what we are doing if you put two different metals in the mouth is the same. We use our patients like experimental frogs, you know, and they are getting some muscular problems because the normal reflex will be from the muscles to tie to some electric activity here, to some galvanic activity. And if you see the redox potential, for example, of titanium in the body, also if you put two different alloys in some electrolyte, always will be some anode and some cathode. So because some of the metals will oxidate. So the titanium has a very electronegative redox potential, as is more minus. And if you put on that titanium implant like a gold-based crown, normally covered with ceramic, but gold is underneath, we have a very electropositive element. So immediately we have an electroacupuncture compared to the connection to the Chinese medicine. And you have an electrolytic resolving of the thin titanium oxide layer, what is will be emitted to the tissue, to the lymphatic system, and in some point over the T lymphocytes what are like reacting to the nanoparticles what appears there, will be a reactive activity of the immune system. It goes to the allergy. Okay, we don't have allergy against titanium. It's type 4 allergy. It causes intolerance. But goes then later to peri-implantitis. The bone will go back from the implant, and they try to treat the peri-implantitis with false methods. You know. They only have to take other metals out of the mouth. That's the only solution. And finally, if you have a longer electrolytic interactivity, then already 30-40% of the patients with titanium implants, even with the hip and other implants, they will get the intolerance, and then they have to, that titanium has to be taken out if it's already happened. So we are lucky if we found it's not really happened already, then in that cases the patient keep the titanium implants, but you have to eliminate every other metal in the mouth. Amalgam fillings, white gold crowns, whatever inlays, whatever is there, we only use then full ceramic constructions, then is no more the problem of the galvanic interactivity there.
And this you can see also by both blood tests and other tests you are doing.
Yes,
here. You can find this evidence before you start to pull things.
Yes.
You can show the patient why this is a problem. Huh?
We use the LTT test or the TST test, titanium stimulation test, so it can be lab approved. School medicine scientifical, so there's no big interpretations. Also, you can find that the first advices with bioresonance, but I use bioresonance only for orientation. Later has to be approved everything, heavy metals or like dysbiotic colon or chronical infections. Always we use school medicine additive methods in the second line to approve it, and then you can see on the X-ray some chronical osteitis, for example, or some inflammation from the root canal, like testing the Rantis, for example, or with the TST test some immunologic reactions to the titanium, even to other materials. Sometimes is gold a problem too. Mostly the white gold, but contains palladium, that is toxical too. So a lot of dentists don't know about that, but palladium-based crowns are toxical. They have to go to the trash, so we take them away. The base of the biological medicine is the same base like of the school medicine. Don't make damage at first, so, but we are more consequent in that. So, okay, so let's see how can be, which things can affect the health. So here we see that's like can be the wisdom tooth that is blocked. Here's not so good picture because that wisdom tooth normally will come out in the right place. There can be some periodontal problems, there can be some forgotten roots with inflammation around, or chronical osteitis, or NICO, how it calls. There can be a chronical pulpitis, like a chronic infection of the nerve without big expression, that's possible too. It can be dead pulpa too, what is not making necessary expression too, so no pain, nothing. You only find out, okay, the tooth is dead and make some problem. There can be some cysts around the dead tooth or a root canal tooth. The root canal teeth by themselves we was already talking about. I will show you later a little bit more. A tooth with a fraction that is still alive but has like a crack. Different materials and even scar tissue what is still infected, chronical. That's all the things can affect the health in general. So if we talk about the root canal problematics, so you see here the cause of all the problems here, because the school medicine doctor will, if the nerve has some inflammation, he will pull that here, soft tissue, out from the channel. So, but the problem is the microanatomy, not the macroanatomy. If you extract only that one, what is 60% of the soft tissue of the teeth, you still have here in the dentine channels everywhere little neural structures with pain receptors on the end. So, because of course, if you have some cavity here in the enamelum and drill it out, it will be not painful. If you go deeper, it's still not the nerve. What is painful is the pain receptor, what is here, connected to the nerve. So, also 40% of the soft tissue of the teeth is in it, like capillary net. If you check it like under the microscope, you will see that's the hard tissue of the tooth, the enamelum, and then here that's the dentine channels. What you see in the dentine, they're like up from 50 to 100,000 per tooth, and the general length of 1.5 to 3 kilometers capillary net. And the problem is that capillaries the entry is too small for leukocytes because like the size of the capillary is 1-2 micrometers. Leukocyte is like almost 7 micrometers, and the macrophage 20 micrometers. They will stay on the entry here without possibility to go in.
So the immune system, also the main factor,
cannot reach it.
Cannot reach the problems who is in the capillaries.
Yes. So, but still will be the protein go rotten inside. So yeah, different things like thioether, cadaverine, putrescine will be emitted, and the immune system will register there's something wrong and will send the army there to resolve the problem. But they are not so intelligent to go somewhere else. The leukocytes, they will stay here around, and that is like immune resources that are blocked there. So what you need in the other place normally. Okay, that's a little bit a slice of a root. That is here the pulpa gum, and that's like the little dentin shells. That's additive. But even the macroanatomy, and that already is a picture from Professor Hess from the University of Zurich, 1917. It's a long time ago. He found out that like almost 80-90% of the teeth, they have side channels like that, even going back here. And like that here, and additive roots here, and side channels here. So even the macroanatomy, how are you gonna, for example, fill up the root canal backwards? It's not possible. Or
it's impossible.
You know, if the dentist found the entry with a microscope, so he will be already happy to see maybe an additive channel and fill it up. It's not about that they are working not precise. They are working very precise today, the endodontologists. But how are you gonna fill up here the side channels? So there are systems with which you can press liquid gutta-percha, hot liquid gutta-percha inside, but with the different diameters of the channels, you have to have a different pressure to fill it correct. So as they will be not filled up or overfilled, what makes the same problem. Also, until now, nobody really disinfect all that here, and nobody was able to fill it up.
So this means then that all kind of root canal fillings is a problem.
For us, is a mess, and you can test that. We have some, even the Western Price Foundation, for example, they make a study and about the bacteria inside. But the side effect was, from that study, they was pulling thousands of filled root canal teeth. And with DNA studies, they was checking which bacteria are inside. They found a lot of different there. No one of the root canal filled teeth was without bacteria. They was contaminated at all. But what they find out that in the periodont, so the periodont, the area normally that is covered with bone here. In that area where the dentin channels are opening here to the periodont, that is open. That system is open and always has connection finally to the jaw. That means obturated central channel doesn't make sense if you have a connection here. Yes. All 3 kilometers of that capillary net is open to the body. It always makes. They find different Staphylococcus, Candida, fungi, Gemella, and even like Escherichia coli, what is normally you find only in the colon. They found in the
dent.
In the dent, yes.
So you also all root canal fillings. This is like you remove whatever in the clinic because it can't be.
They don't have right to stay there. That's like dead zombies. What are you bring to the grave finally?
Yeah.
So that's the Institute for Medicinal Diagnostic in Berlin. But scientifically approved, they show up how the products of a rotten protein, mercaptan thioether, activate immune system direction allergy, for example. So and we have inflammation always. There's some methods how to find it, like our cone beam X-ray, for example, or that's the cavitat, what is not permitted to use here in Switzerland, but like in Germany. With that you can found out the density of the bone. Less dense bone shows up in the area where is a chronical inflammation.
This is a kind of ultrasound, or?
Ultrasound, yes. Yeah.
Mm-hmm.
So, okay. The other test is with what you can find, of course, with the Vega test, like bioresonance or acupuncture. Some points are connected to the teeth area here in that area. Can show active inflammations, or the cavitat, or the orotox or topaz is like good method to find that theater, for example, in the pocket of a root canal tooth. That's the second scientifically approved method to see the emissions of a root canal tooth, for example. Then you have some results. But let's talk about the materials. So if somebody fill up your root canal tooth, no of the dentist will ask if you have a latex allergy. Gutapercha, the tip which will be put it in the root, is latex. So also and has a high allergical potence, compared to the Institute for Diagnostics in Berlin. Or already the sealers what we use to fix that part of gutapercha, they are toxical, partial, but have the allergical potential too. So not even the materials are like biocompatible, let's say, what they put in. So that finally we will get like a chronical inflammation around the root, sometimes visible on the X-ray, sometimes not so. It's dependent from the activity of the immune system. If it's keeping busy somewhere else in the colon, for example, then you will here have a less inflammation, less visible. So how that chronic cholestasis can appear if you extract the tooth and here you have still bacteria. Sometimes here in the upper area only the gum is closing, but here is still contaminated with anaerobic bacteria, and then the bone will maybe grow around, but you have still a cavity here.
So this is the problem often with the normal dentistry. They are just pulling the tooth and they are sewing it together, and they don't take care of what is happening in the pocket. It's
a noiseless form of chronic osteomyelitis, so that the school medicine understand it. Chronic osteitis they don't understand. So, but it's you can verify even with the Rantes test, or by opening. The cavity is empty, and sometimes it really smells very bad, anaerobic smell of rotten eggs.
And when the patient comes to you with this kind of problem, you have to open this and clean it?
Yes. Like we did it with your wisdom tooth. Has to be open. Normally is jaw already organized here around, as you have to penetrate it with a little cut, clean it out, disinfect with ozone, give some homeopathics. Push the immune system high, because normally scar tissue isolating all that area. Because of the scar tissue, normally the immune system, the leukocytes and macrophages, they cannot go through. So that has also be scratched out everything, disinfected. Then we put the PRGF inside, that plasma growing factors, plasma, and then normally 6 months later you have organized bone there.
And a problem like this can be one of the main problems behind cancer, behind arthritis, behind ME, and so on and so on.
Definitive.
Hidden, but still very active.
Yes, working. So that was first from Dr. Lechner, make it public, but first the Professor Bourcois was pointing to that problem, so some cavitations here in the jaw, like that. That's why I put the Dr. Lechner, for example, here. He is from his presentation. He has no more jaw around, it's only the nerve in the middle. in the cavitation around. So that is
doesn't look very healthy.
Yeah. So, and with the contrast X-ray, you see how big is the volume of that. With the nerve, it's the same case. So that's that cases they are not so often that will be visible even in the normal X-ray, but often we can find it only with the cone beam X-ray, like if we check really three-dimensional that area. Okay. So also the study of the Professor Boko and from Dr. Lechner, they are like scientifically approved. You can go to the webpage drlechner.de, even in English you have it.
And have they see the cavitation?
Also here is only like already from the color changed bone, here like cavitations. I think they are going underneath like that. You don't, it's only a slice, you don't really see, but if you have to clean it out, you see already is contaminated with bacteria, change the color. Healthy bone don't have that color. Here's like yellowish like that here.
Yeah.
Oh. Okay, some fat degenerated cells is ingredient of that cavitations, for example. The histological like tests. Also, finally, they make a really big study about that, and you can approve that. That's a form of osteomyelitis, what normally goes without local symptoms, but has an affection of different systems. Yeah. So, and there's, for example, lab test. If you in the lab test found rantes here, high concentrated, you have to search for dental problems.
This is
root canal teeth inflammations.
This is like they found with me. High rantes, and then check with the dentist.
Yeah. So that was it. So, for example, one of the things how we make an amalgam sanation maybe will be the protection.
Yes.
So ourselves we protect with fresh air and helmets like that. So the patient will get nasal sound to breathe because the amalgam fillings, if you take them out by draining out, will be up here in the mouth area here, the mercury mist. That has to be evacuated with a system like that. So a filter system what sucks away all the mist, and with special methods to ventilate them out. We have done like any additive. Important part is the infusion, detox infusion direct after or before the dental session, so that if some molecules of mercury already are in the blood, they don't have time then to go to the tissue. They will be taken out from the infusion and released over the kidneys.
And of course you use the rubber inside the mouth and protect the gum.
Sometimes yes, sometimes no, because the rubber, some studies said that rubber is not a barrier for mercury mist. That gas can go through, and under the rubber you don't have ventilation. And it has time to go to the gum. So we are more for the good ventilation. Like rubber is more like a burden in that case. So we don't use rubber.
Okay, so you use heavy ventilation and take everything out at once.
Yes, and of course detox infusion is the best one. So we are sure we don't contaminate the patient again, because 50% of the volume of amalgam filling is mercury. Yeah, so and that all goes by 38 degrees. Mercury is already in mist form, and you have it everywhere. Good ventilation of the room will be good too. So also to all the dentists who is still not protecting themselves, check with the DMPS your mercury level, because it makes Alzheimer and other problems later.
So you both have this equipment on you. So when a patient come here at the Paracelsus Clinic, the first thing they are sent to is the dental clinic, like I was. And here you're going through the panorama X-ray, you take the 3D X-ray, you do all the tests and you check the health of the patient.
Yes.
And out of that you are planning out treatment plan.
Yes.
And like you did with me.
So sometimes we have to wait with dental treatments because of the immune system of the patient, but that will figured out in the medicinal section. They will tell us, okay, that patient, please don't make surgery. You have first to rise up the immune system and prepare him. So, but always is possible to make metal sanation amalgams out and white gold and other things. Maybe even the titanium implants, but that is in some cases they will be let it there. In some cases we have to pull them out.
Yes,
it's the individual dependent.
So I will say from my own experience, maybe the best investment I have done so far the last 15 years when I was searching for my health issues was to come to you and to do a real check on my teeth, where you also found on two main problems who nobody else have been finding for 15 years, also other holistic dentists. And for me this has been, I guess, the best investment I've done in these 15 years.
Thanks.
And
by the way, we have our Paracelsus Academy. We are teaching everybody about dentistry too, so that if some dentists are interested to see what we do and to get some more information, so they can go over the web page to the Paracelsus Academy, and we are happy to have here hospitants. Quite often we have somebody here who is looking what we are doing, and of course we introduce them to the medicinal session so that they figure out how maybe the own network has to be later in their own practice of what you need.
So you don't keep this as a secret, you share it by...
No, we are interested in sharing, so because successful treatments makes happy everybody, the dentist, the patient, and you will get more, like a dentist, more patients if you have success, so I think.
Yes, we definitely need more dentists like you. Thank you, Dr. Reifert, for the interview and for the treatment.
Okay,
I feel much more happy and healthy after this 3 weeks in your care.
Thank you.
Thank you.
So, and hope you get more strong. You have some other things to do.
I have still stuff to do, but at least two of the main factors have been away, and then I need maybe a year to build up all the other havoc that happened.
Okay.
Thank you very much.
Thank you too.